Ready? Okay, let's get started. We call this meeting of the Edwards County Hospital District Board of Directors order. And I'd like to start off with an invocation from Pastor Doug, Chaplain Doug. Chaplain, would you remember Kathy Dagnon? She lost her mother and also Brenda.
Yes. I got Brenda on the list. Good evening, everybody. My name's Doug. I'm staff chaplain here at Medical Center Hospital. Please continue to keep Miss Bryn in your prayers. Continue to keep Dr. Art in your prayers. He's exhausting every avenue to remain healthy and acquire a long and normal life. So we appreciate your prayers. Let's pray. Father, your word tells us to pray for leaders first, so that's what we do, dear Lord. We pray for our leaders. We pray for our country, dear Lord. You know, this is a huge day in our country today, dear Lord, and we just ask you to lead and guide and direct. Father, I pray for our staff members. Our staff members are not becoming weary in well-doing. They're the greatest staff in the whole wide world, in my estimation, dear Lord. And I just pray every day for them. Pray blessings over them, that they stay safe in everything that they do, dear Lord. Father, I pray right now that you would just have us to be led and guided and directed in the way that we should by our leaders here at the hospital, by our board members, and Mr. Tippin, Mr. Yoon, dear Lord. And Father, above and beyond everything else, we just want you to be glorified, we want you to be honored, we want you to be praised, and we give you all glory in your holy name. Amen.
Thank you. Richard, would you give us our mission, vision, and values?
Yes, our mission, Medical Center Health Systems, is a community-based teaching organization dedicated to providing high-quality and affordable health care to improve the health and wellness of all residents of the Permian Basin. Our vision is MCHS will be the premier source of health and wellness. And our values is the eye care, is the integrity, customer-centered, accountability, respect, and excellence.
Thank you. And also, right now, we'll just state that if there's a conflict of interest by any of the board members, now would be the time to disclose that for anything you're going to be doing. Also, right now, we'll take any public comments from anybody that has anything on any of the agenda items for today. Anybody online or anything that you know? We'll go forward. Hey, wait a minute, let's stop just a second. Would you guys please stand? Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Honor the Texas flag. I pledge allegiance to Texas, one nation.
Indivisible.
There you go.
It's been a long day.
All right, I'm sorry about that. That was my mistake for today. Consent agenda. On the consent agenda, we have consideration of everything listed. Entertain a motion for consent agenda.
Make a motion for approval.
Motion second, all in favor, say aye.
Aye.
Opposed, same. Motion carries. Committee reports, Mr. David, let us know what y'all did today in finance. Again.
The Finance Committee met 5 o'clock this afternoon. We received the quarterly investment report from Charlie Brown and the quarterly investment officer certification. Financial report for the month ending September 30th. On the consent agenda, we had considered approval of TV advertising and marketing contract renewal, consider approval of secure contract renewal, consider approval of Sophie pricing renewal. And then also we considered approval of the Scorpion website agreement, approval of the Da Vinci Exile robot lease agreement, the COVID-19 partnership with Odessa College and the city of Odessa, and capital expenditure request of the Belmont Rapid Infuser. I make a motion for approval on all items.
Second.
Have a motion and a second. Any questions on any of this? All in favor, say aye.
Aye.
Opposed, same. Motion carries. Thank you. And, we're to Mr. Tiffin already.
Just a few things quickly. One, we are doing our first 2 watchman procedures tomorrow. I know that's been a year in the making, so we will perform those 2 procedures tomorrow. That'll be done. We've already spoke about Kathy. Kathy is our HR director. Her mom unfortunately passed away. So we please keep her in our prayers. On our COVID situation today, we have 51 in-house. We're expecting 8 or 9 discharges today, so that'll get us back down to the 40s. We currently have 60, that's 60 employees on COVID leave, whether that's exposure or confirmation. Most of those are coming from cohabitation, so their spouse is having COVID, and so they're getting it as well. Honestly, we have very little COVID exposure at the hospital. It's probably one of the most safest places out there.
I'll be here tomorrow all day.
COVID is, this 60 is the biggest number we've had through the whole shooting match, so this has been a number that's a growing concern. Let's see, we had 13 COVID deaths in October. 10 of those were from Ector County, 3 of those were from we did convert Wheaton Stewart with critical care overflow to the outpatient. Procedures are being completed in the main OR suite. Now that is converted back. So we've got that set up now. We can move that back and forth pretty quick. We did convert it and have them back. Currently, we have 130 PCR tests, rapid tests in-house. We get a weekly shipment of these, allocation from the state. In the event that we grow short on testing, we will convert to admitting patients as patient suspect. About a week ago, we did get in a pretty hot spot. Our friends at Odessa Regional did send us over 100 tests because they got more than their allotted amount, so they sent them over to us. And so we did use those. We did get in a point 2 a couple weeks ago where we had 57 COVID. Odessa Regional had 17. So I said, hey, how about we send some of ours over to y'all to lighten the load a little bit on our crew. And they did. They took 10 of those in about a 24-hour period. So they took 10 of our patients, and that did loosen the load a little bit on our crew, which worked out pretty good. Never happened. We sent patients over that. It did work out pretty handy for that. Also, let's see, with the increased critical care of COVID patients, we have arranged for our current intensivist group to provide NOC coverage as well as a swing shift. So this will give 24 access for our patients to care for our physicians to care for the patients and give extra support and care during peak hours. This is something we've been struggling with for a while, but we did convert that over to. We'll have a physician in there. Was going to nurse practitioners. Is that right? Nobody. So now we have a physician in there 24 hours a day. So that's just talk about D&B. Our new accrediting agency was here today for our initial visit. They'll be here for 4 days. I can tell you the move was totally different than D&B. It is not a hop with gotcha hop situation. It is a hey, tell us what you're doing. Let us help you improve your processes. Today, our closing session with them was very proactive. They were very impressed with what they saw today. Our exit with them will be Friday, about 12:30. Let's call it 12. We would encourage any board members that'd like to come up here at 12 o'clock on Friday afternoon. Hear that, to please come. In fact, we'll serve you lunch if you want lunch. But that will be 12 o'clock Friday. It'll take about 30 or 45 minutes, and that'll be the big grand exit. So they'll be here all day tomorrow, all day Thursday, half a day Friday, so about 3.5 days worth of our elective surgeries. If you remember, we've been dancing on the 15% number. We get as high as 12%, but that number is holding steady today. Hence the reason why we're able to convert Wheaton Stewart back over. I know some of y'all get calls when we put out emails that, hey, be ready. There may be a chance that we have to delay some of those or slow those down. I know y'all get some few emails or text messages. We do not take that lightly, but it is something that we have had to consider. We keep that on the front burner just to see what happens, because if we go over the 15%, we'll have to make a move.
I'm moving with you, we do, because my wife doesn't have her knee replaced end of this month, I'm not gonna live with her anymore.
Well, our good friends over at Middle Memorial today called us. They have over 60 patients with COVID in their hospital. They're wanting us to take 14 of those, which we could not do. So they actually reported 233 new cases today in Midland County. So that's a big number. Not sure what's going on over there that's driving that number, but they did have a big pop there today. We did receive on Friday. How many FEMA nurses did you get from the state? Kristen?
We have 8 nurses and 3 respiratory therapists, and we've requested 10 more respiratory and 20 more nurses.
Even though Kathy's not here, her group worked with Attorney Steve, and we got some paperwork together, and we got those people taken care of really quick. And HR did a great job getting them on board Friday and get them in the work pool immediately. So even though Kathy's not here, we do want to give her and her crew a good pat on the back.
Russell, when you say FEMA, is that on a loan, or what's the term on that?
Yeah, go ahead, Kristen.
So it is on loan. We don't pay these individuals, obviously. We credential them, get them in our hospital. Some of them will be here a week. Some of them can be here for 3 to 4 weeks. We just never know. So we take them and we rapid get them through the system and use them until they come to us the day before and say, they're pulling me and I'm going elsewhere tomorrow. So we just kind of place them on the schedule where we need them.
All right. So with that being said, the rest of my stuff I can cover in the executive session, so I will give my time back, sir.
Well, real quickly, before COVID, earlier last year and early this year, also when I was out working in the community, talking to folks about different things, and one thing that was recurring and was stressed was that they would, the people out there would like to see us get along with our hospitals better and play better together. And COVID has taught us that we can play well together and that it doesn't kill us to send patients back and forth. Competition breeds competition. So we appreciate all that we're doing in that, and we want to stay in that direction and look like we're grown-ups.
That's been a real positive for the community.
Yeah, we've gotten good feedback. And some of this, some of the calls that we do get are good, and that's something that's been good.
There was a time before COVID?
Well, Chris and I were just on a call that morning about how our staff is just run down. We were running out of nurses, and then we get on this call, and they're like, oh, we've only got 17. I was like, we need to send you something. What's it going to take for y'all? But just the same as that, Vegas, Reeves County called us the other day. They needed 6 files of red visitor, and we were able to. They came over and got them, and shipped them over there. And then when they got their shipment in, they sent them right back. So it has made some collaboration happen that probably hasn't happened ever.
We do have pilots that are sitting out waiting to do things like that for y'all if y'all need them. Sitting down waiting. And they've done a lot, especially when COVID first started. Okay, well, thank you for that, Russell. And what's the next one? Delaney.
It's Dr. Delaney
How are you doing, Dr. Delaney?
from Crane. Crane.
Are you hearing me well?
Yes.
Or do I have to speak in?
We hear you well. We hear you
Thank you
well.
very much. So the applicant for residency training programs so far, we have 2,000 for family medicine, 4,000 for internal medicine, 900 for psychiatry, and 350 for OBGYN. Some of our Texas Tech students also, not only from us, but from Lubbock and Amarillo and El Paso, they are applying now, more than ever. So
We hope that they are, we know they're good students, so we hope to be able to keep them. All the interviews that we do, usually 10 to 12 applicants for each position gets an interview, will be through Zoom or Skype. We hope to have a lot of our students to train with us. Our all medical students must also interview, if invited, through Zoom or Skype. No on-site interviews will be allowed by the American Association of Medical Colleges. There's a lot of concern regarding international medical graduates applicants this year, and that's why we hope to get more of our students. Our clinics are fully operating: internal medicine, psychiatry, endocrinology, mostly through telemedicine, family medicine, pediatrics, a combination, obstetrics, mostly mask to mask. I start doing some through telemedicine, I will lose my license probably. Geriatrics moved to Odessa and Midland from Podry in October 31st of 2020. Our COVID positive staff, medical students, residents, fellows, and faculty have remained very low, fortunately. We are waiting for the new Texas legislation. We know today that it was supposed to be dedicated to the higher education before COVID. Unknown how now, since Texas budget is looked to be short by $6 billion. We have a new commissioner, higher education commissioner. We have the need for new resident grants, around $220 million, to preserve the 1-to-1 medical students resident ratio that the governor wants. But we have also 6 new medical schools in Texas. Those grants, as you know, $75,000 per resident per year since 2014 have allowed approximately 400 new residence positions in Texas, including approximately 87 in the Permian Basin. Thank you very much to the board, to the administration, to the medical staff, and everyone involved in education. Our medical students, residents, fellows, nurses, PT and PAs. I want to give the annual plaque. You can come and somebody takes a picture.
Okay.
And send it to Gladys.
Send it to Gladys.
Watch your step. Don't trip, Russell.
The Texas Tech the Health Sciences Center at the Permian Basin presented to Medical Center health system in grateful appreciation for your outstanding dedication and service to Texas Tech HSC at the Permian Basin and the community of West Texas. Thank you. Thank you.
Thank you.
Russell.
With that, we'll go into executive session. Oh, wait a minute, one more thing.
One more thing. Sorry, I forgot this one. I got so excited, I'm quiet.
We'll go quickly through. If you guys remember, back when I first came on, I had actually met with Dawn and we sat down in the emergency room for a few hours and discussed how cumbersome that process was, and that I really wanted to fix that. They've been doing a lot of work in the ER to kind of shuffle things around, moving physician time so that they can make the flow a little bit better. And so that was really something that we talked about, I really wanted to work on. So you'll remember several months past, we did an agreement with Vizient to bring them here and look at our process. Live on our total revamp on August the 31st. So I wanted to give you a quick snapshot, just 3 or 4 slides to show you some of the great work that the emergency room is doing. And then as we get more into, I'll have David and his team come and give you a formal presentation. So this goes all the way back to October of 19 to kind of give you a full picture. We were averaging averaging 30 minutes to arrival to bed. That's the time a patient gets registered and goes back to the bed. Our project started in August. You can see that there. And as of the end of September, when we pulled these records, our patients, from the time they stepped in the door to the time their honeys were in a bed back in the emergency room, was a total of 8 minutes. So that's really the patients not sitting in the waiting room. Those are direct bedded. And we're giving the patients a sense of, I'm being cared for the minute I walk in the door and I'm not having to wait even those 8 minutes, because we're putting them in a wheelchair from the time that they walk through those glass double doors. And then they're wheeled around through the rest of their stay, giving them the perception that they're being taken care of. Arrival to MD, just some key points I wanted to show there. You can see we had at the beginning of 2019 fiscal year, 45, 50 minutes worth of a wait to see a physician. Then we started averaging 20s and 30s in order when we started shifting physicians around. And now you can see it's September after our project, 12 minutes for 8 patients to see a physician. So they're in the bed at 8 minutes, and 4 minutes later, they have a doc in the room assessing them. In fact, I was in the ER just the other day. Dr. Taylor was standing at the door waiting on the patient to get to the room. And so I think that's a great perception. I'm down in our emergency room with our physician engaged. This is kind of a busy slide, but the very top line that's wavy is where we were on our arrival to departure. That's from the start of their walk through the door till they leave to go home. These patients, you can see it was close to that 200 mark. And then today, or for September, you can see we were down to that 150 mark, and year to date, we're running it at 163.
Minutes?
Yes. So those are minutes. And then we're actually meeting the national benchmarks. Those are running about the 160, and we're running a little bit below that. So now we're hitting a national benchmark, well on our way to the state benchmarks across Texas. Left without being seen, we all know this equates to a lot of money. So you can see at this time in 2019, we were about 4% of our patient population left without ever being seen in the emergency room. They just got tired of waiting. So that's a lot of money walking out the door. As of September, we are at 0.4%. And then year to date, we're averaged about 1.67. So you can see from that wavy line at the top, kind of where we are and where we have come in all these years past. I really do think that you're seeing a lot of money saved just from patients being directly vetted and not getting tired of waiting and leaving the waiting area. And then this is just a kudos to our registration staff. We all know that if they don't complete a registration and get all of the patient's information and their billing information, that we can't bill the patient appropriately. So if you want to look at the very beginning, I know it's a lot of bars, but July of 2020, we were hitting about 22 patients that we never finished their registration. They came in, they were seen, they went home, and we forgot something, and so we couldn't bill those kinds of patients. I want you to see within the first day, it dropped to 3 patients. They fixed that registration process. And now you can see that there's days that there's only 1 or 2 people that leave without registration completed. And I will tell you that those leaders down there, if you ask them what happened to those 2 patients, they can tell you. This one went to surgery and that one went here, and that's why we haven't finished, but we're getting it tomorrow. They're really on top of things down in that ER registration. And I think part of that is saying the team is engaged and we reworked their processes. But the ER director and the registration director came together and said these people aren't just registration and they shouldn't just report to registration. They're a key part of the ER, so they report to both leaders. And so both leaders are holding everybody accountable to those processes. And so that's what's really driving this change. Engineering has been a key part of our project in trying to move and drop walls for us. Carlos really hates to see my number pop up now. So morning, I would really encourage all of you, pictures do not do the engineering work justice, so if you wanted to go down there and walk through the ER. Now, when the patients come in, we took a portion of the waiting room out, because we don't want them waiting. We're gonna sort them, see if they're a PUI for COVID or if they're not, and then we take them straight over to a triage room, so they're feeling like they're being touched as soon as they enter the door. We took out some of the police department area, made 2 extra triage rooms so that we could have more fast track rooms. Those are all painted. Those fast track rooms line behind the original registration desk where the glass is. So it gave us more fast track rooms so that when we have days like yesterday where there's 140 people that come to the ER, they can be seen quickly, sutures, cough, colds, and on their way quickly. Of course, there are some things going on in the back that you think, well, I don't really know what this has to do with efficiency, but larger lab space, this is going to help us expedite some of our COVID testing that we're placing down in the ER. Moving the tube system to where the doctors can dictate and get people in and out, and we can get to the tube system to send labs. All of that stuff contributes to how many steps people are taking in order to get things and move people through the emergency room. So none of this was done with one person alone. That ER team has been amazing. The leadership down there is really been driving. We have not a weekly, but an hourly text message that goes off to tell us who's in the waiting room, how long it's taking, how many patients we're seeing. So it literally is an hour by hour update that Steve and I get along with the leadership team to really drive the process. And you can see 8 weeks later, they've cut their times in half, if not more. So I really do foresee that through the upcoming months, we're going to have a great program to present to you guys and complete. For me, any questions?
I have a question. So the different things that you came up with that you wanted to improve have you done all of those, or do you have more in the works?
Excuse me, there's still some things in the works. They're finishing up with all of the ER physical stuff, but then we also have physician schedules we're looking at so that we're getting on the front end of the care and not trying to catch up on the back end, maybe bringing them in sooner, those kinds of things, as well as staffing schedules to make sure that we're watching and having staff here when we have large numbers of people and sending staff home when we're not. So I think it's going to be a continual work in progress. And every time we have a call with Vizient, they bring up more things because they're seeing it from a different perspective as well, and working through what that might look like. I think you're even going to see a discharge station coming up so that we get patients out of beds to a discharge place and then sending them home. So there's still more stuff that we have to finish.
Good. This just kind of goes along with what the Leader's Choice Award that, I don't know if this emergency room's ever received that before. Y'all know more than I do, but I thought that was pretty nice.
Yeah.
That usually our competition gets that, but we got it this year, and that's just, Kristen, thank you for the work down there because it's definitely a huge improvement and it helps our patient satisfaction score.
So y'all understand the moral of the story. If you tell Kristen don't work and she can't fix it, this is what she'll do to you.
Great work.
We had many conversations down there that night. We're like, why? And he's like, you have questions, Kristen. Well, there you go. The leadership team has really done a great job down there. I can't say enough about David and his group.
Very good.
I would make sure
That's what's going to make this 5-star.
that they know from the board that we appreciate it.
Okay, I will definitely pass that on. I know many of them are on the phone, but I'll definitely share that you guys are really proud of what they've done.
Very cool.
And I plan on going to look at it.
You should. It's really nice.
Now, go into executive session. Meeting held in closed session involving any of the following: consultation with attorney regarding legal matters and legal issues pursuant to Section 551.071 of the Texas Government Code, deliberation regarding real property pursuant to Section 551.072 of the Texas Government Code, deliberation regarding personnel matters pursuant to Section 551.074 of the Texas Government Code, deliberations regarding negotiations for health care service pursuant to Section 551.085 of the Texas Government Code, deliberation regarding economic development negotiations pursuant to Section 551.087 of the Texas Government Code. Thank you.
I think Don made that up just so he